Welcome to Age Pension, Super and Retirement. I'm your host Yvonne, and remember that this is information and opinion only and not personal advice. Today, in our series on aged care, we will be looking at home care, and I'm delighted to welcome back the Director of Prosperity Planning Partners. Welcome back, Gayle.
Oh, thank you.
Let's go with our very first question about aged care and the home care situation. How does home care work?
Well, let's put it this way. There's lots of changes coming up. There have always been lots of changes in this arena. And I suppose the first thing is the entry level, for want of a better term, is CHSP, which is Commonwealth Home Support Program. Most people would be more aware of the home care packages because the home care packages tend to provide care. The CHSP stuff is not necessarily a lot of personal care. It has a tiny little aspect of personal care, but it's basically the entry level to support, to keep older Australians living independently and at home. And the target group for a CHSP, which is the Commonwealth Home Support Program, are people who need a little help with daily activities. By contrast, we've got people who are receiving home care packages, and there's a significant difference in the type of care that's provided there. So we've got ongoing and coordinated care inside of the home care packages for people who've got more complex or higher care needs. And these people tend to need more structured and regular support over the long term. Now, I always look at the two and go, a home care package, both of them, is designed to keep people at home. But the home care package over the Commonwealth Home Support Program is superior in that it gives access to clinical services, allied health, aids and equipment, home modification, transport, and domestic help. CHSP, by contrast, is a little bit more limited. It's usually single or maybe one or two of these following services, and that could be domestic assistance, for example, help to clean the house or change the bed, meal prep, personal care, which would basically be maybe sometimes helping with the shower, and home maintenance, social support, and transport. So there's a big difference between what's available under a home care package and the CHSP program.
That is so helpful to know, and thank you for always mentioning what these letters stand for, CHSP. Now, I'm curious, after that, there is something which has levels, another type of home care package. I'm being vague here, but I'd love you to unpack that.
No, that's fine to be vague because most people are really vague when we start to talk about it. A home care package, let me just step back one little tiny bit. This is for understanding how we get access to a home care package. Now, in our last conversation, I mentioned the ACAT assessment. So, Aged Care Assessment Team. They are the ones that can help initiate a home care package. So they do the assessment, it's in person and it's comprehensive, and it covers a whole range of things, medical, functional and social needs. So it's quite a comprehensive assessment. Whereas if you're going to be able to be accessing the Commonwealth Home Support Program, it's got a different assessment body. That's a regional assessment service. The process is much shorter. It's a much simpler assessment, and it can often be done by phone or a quick in-home visit. So that's the big difference between the gate openers. One's the regional assessment, and you'll hear that referred to as the RAS. And then the other one is the Aged Care Assessment Team, and that's known as the ACAT assessment. So CHSP, the Regional Assessment Team, home care package, the ACAT team will decide your level of care. Now, currently inside of the home care package, there are 4 home care packages. level 1, 2, 3, and 4, and they come with different levels of funding. So right now, it's August 2025, the level 1 home care package is $11,000. Home care package level 2 is $19,000. Level 3 is $39,000, and level 4 is $61,000. But after the 1st of November, there will be 8 permanent package levels. The first one doesn't increase, but so the funding for that will still be $11,000, but it will go right up to level 8, and the funding for that currently is expected to be $78,000 a year.
That's really interesting to know, and I love the fact that we're getting granular here, and you've also started to mention some figures. So my first question around organising perhaps an assessment, or after the assessment's been organised rather, is there much of a wait time for such a package, and if so, why?
Well, the federal government, every budget, say we've announced more places for home care package services. Problem is there's a challenge around having the staff available to deliver the packages. Now, that may sound stupid and counterintuitive. The government saying, yes, we've funded more packages. The problem is it depends. Sometimes we can have months worth of waits for a home care package, up to over a year, depending upon the level of package you've been approved for. Now, I know in the past I've had some people say to me, oh, Gayle, I'm supposed to have a level 4, but they only offered me a level 2 and I turned it down. And I nearly have a coronary every time I hear that, because what they don't understand is that at least if they've got some form of services, yes, at level 4 funding would be $61,000, level 2 funding would be $19,000, a big shortfall. But once you're in the system and you're getting services, it helps them to be aware, and potentially if another package comes up, as in an increased package becomes available, because you're in their system, you're more than likely to receive it than if you are just going, no, I'm waiting for my level 4.
And you can imagine people not knowing that they are going without by knocking something back.
100%. And the difference is with a Commonwealth Home Support Program, CHSP, it's often a very short-term wait period, and services can start quite quickly because the services are not necessarily clinical. They are more like home maintenance, help with preparation for meals. Whereas when you start to get into the home care packages, some of them will have, depending upon the individual's health, have a significant need for clinical services. And this is where we come unstuck, because as a financial planner, I could become a home care worker, but I don't have the clinical services to go and skills to go and provide those types of services. So it's really important for people to understand that a home care worker has to do generally a short course, but it doesn't mean that they've actually got clinical skills, which is part of the reasons why there's that challenge around getting access to the bigger packages, because they're more likely to bring with them clinical services being needed versus somebody going, oh, can somebody come and mow my lawn?
Yes, that's really fantastic to know all that. And I'm curious now, you've mentioned some big figures, and I'm curious, can someone self-manage a home care package?
Currently, yes. And I say currently because I found out just recently, I spoke to one of our technical services team, and from the 1st of November, they're going to be having a minimum of 10% of your package, and the range there is from 11,000 right through to 78,000. That 10% of that package will have effectively a management fee applied to it, regardless of whether you self-manage or not. So at the moment, yes. Going forward, no, maybe not. You can still self-manage, but you're going to have to pay the fee that is a standard minimum requirement of 10% of your package amount.
So just to be clear, with these fees, you said minimum.
Yeah, hang on. It's 10%, is the amount. But if you haven't spent all of your package, it can be less than that because they can carry forward a little bit of it, but they can't carry forward much. And we still haven't got exact numbers on that, but I know that there is a possibility for part of the admin service, if you haven't used it, to be, service fee, haven't used it to be carried forward into the next quarter. And moving forward, they're not just going to issue the cash to the providers as they used to. Way back, they would say, here's the package money, you go and deal with it. They will basically have invoices submitted and paid, but they're not going to just provide the lump sum funding anymore because people sometimes moving to care, leaving the planet entirely, where they no longer need that home care package, and it made it very hard to administer. So a bit of a challenge when it comes to managing the whole process of home care package costs.
That's so helpful, and I hear there's a lot going on, information changing in real time by the sounds of it, Gayle, with these big changes.
Yeah, 100%, yes, because these big changes came about from the Royal Commission into Aged Care that was done a few years ago, and the changes were meant to be effective as at the 1st of July 2025. And when it comes down to it, there's going to be a range of different fees built into these home care packages depending upon whether you need social services, clinical services. There's 3 different levels, and depending upon which of those columns the services you're consuming are in, it means that effectively you may be asked to make 0 contribution for clinical services, right up to 80% personal contribution based on the social side of it. So it's going to totally change service delivery, and it's the reason for the delay is none of the home care providers, none of the residential aged care facilities have actually got their financial software, their billing software, able to cope with all of these changes. It's an absolute nightmare. Somebody went, let's do this, it's a great idea. And all the providers have gone, oh, what were they thinking? Because effectively now it's become so much more complex, which is why that 10% is going to have to be allocated to a management fee for the packages moving forward.
That's so interesting. I was going to say tricky while this is being rolled out. And can I ask, Gayle, is the home care package itself means tested?
Well, at the moment, currently it's income tested. And that means that you can be asked to make a financial contribution to it. They don't check your assets, but it's income tested currently. There's scope for that to change again after the 1st of July because you are going to be expected to contribute regardless, because currently the programs that are in place, that some of the providers have just gone, look, we're not going to ask you to co-contribute to this. So we'll just spend your package the best we can to give you the care that you need. Moving forward, it's going to fall more into the user pays system, and that's going to see the cost of home care increase, and it's also going to mean that you're going to have to pay something towards this. Now, it's still a moving target. I know that sounds weird, but ultimately they are going to bring it more into line. If you are paying what is now effectively a means-tested care fee, which is where you're paying and contributing to a home care package, that's going to carry forward into when somebody moves into aged care as a permanent resident. Moving forward, we're going to find that it will become far more complex. The means-tested care fee, as it's currently known, will actually be able to be carried forward into the new aged care fees, because there's going to be an ongoing calculation on that side of the agenda, shall we say, for people to be paying more for consideration of being in permanent care than they currently are. So the means-tested care fee is going to be abolished as at the 1st of November. It's going to take on a different name, and for the life of me, I can't remember what that is right now, but it is effectively going to include assets and income, and it will have a ongoing amount that is going to be CPI indexed, and as the current means tested care fee lifetime cap is, but it will be a much higher cap moving forward.
Thank you so much, Gayle. And before we go on to perhaps finding out if there are any other changes on the 1st of November 2025, a reminder that this is information only and not personal advice. And if I could ask Gayle, now Gayle's a financial planner across all areas of financial planning, not just aged care. How could you be reached?
You can email me at Gayle, Gayle, at prosperityplanning.com.au, or as many of my clients do, they give me a call on 0407 159 298.
Wonderful. Now, I know this is all hot off the press and perhaps the ink isn't even dry in some areas. Is there any other way that the home care package changes on the 1st of November?
Well, yes, it's going to get more expensive, but everything is getting more expensive, sadly. It's going to have those three different components, but effectively you're going to have to co-contribute depending upon where your services that you're using, which of those three columns it fits into. Clinical services are meant to have a zero add-on, so there will probably be an increased demand for that. And the social side of it can be a very significant increase in contribution, can be up to 80%. So you've got to be cautious when you're putting together your package to try and make sure you get great value, because even if you've got a really big package, you're still going to have to financially contribute to this depending upon the services you use. So please, please be very aware that it's not just about taking mum or dad to the club. I've got one lady I know who has to take her mother to the club to play the pokies because that's mum's thing. But somebody going to do that service for you, effectively you're going to pay their hourly rate and then you're going to be asked to contribute up to 80% of that hourly rate. So consider that, guys, when you're thinking about how you consume the services.
Yeah, I like that information there, Gayle, because this would not be apparent to most people.
Oh, no. And it hasn't been, because it's going to be a massive change to what the current system is. So somebody who's in the system already and has been there since, I believe it's the 14th of September 2024, they don't have any changes coming in the short term. But it's those people that are going to be taking on home care services after the 1st of November that the cost is going to rise significantly.
Fantastic, Gayle. The last question before we bump out of this episode, what happens if someone's home care level changes after the 1st of November?
Well, as they're in the system already, the intention is that they will be grandfathered for, I believe it's up to 2 years. And once that 2 years has elapsed, then they may be asked to move to the new system. And it will depend on who knows what the government's going to do, because this change has taken so far around 4 years to get to us. They've delayed it 5 months from its proposed starting date. And I know that I've told you before, but this is the 5th iteration of fees that I've seen as a financial planner that focuses on aged care since my mother-in-law went to care in around 2008. So this is an ever-changing area of tinkering because the government can't really afford to fund all of the home care packages that it says it's going to fund, because there's firstly not enough staff, and then the other thing is cost of delivery of service to keep people at home, because these services are done in your home, are significantly higher than if you were in an aged care facility where it's all done under the one roof.
That's wonderful, Gayle. Thank you so much for helping us unpack this area, the home care packages. Now, for any international listeners who are wishing to join our Facebook group, Age, Pension, Super and Retirement, the code word is RED. And again, this is only information and never personal advice. Gayle, thank you so much.
You are more than welcome.